Hey everyone, it's Vanessa, psychotherapist and GLP-1 user. I am coming in. I wanted to just come in and geek out with you all for a little bit. Those of you who are interested in the science behind GLP-1s, this is going to be a quick video. I just found something really fascinating that I wanted to share with you all. So if you are a geek like me and you like the science behind things, then you may want to stay tuned and stick around for this. Very interesting information that supports GLP-1s and the history of the research that goes back decades, not just 10 years. This goes back decades, and I am talking in the 70s. So if you're interested in that, I'd love to share this information with you. I'm going to give you all the article names so that you can look it up and read it for yourself. The fascination about these GLP-1 medications for me is always the time that I find out that they have been in existence, because we have heard that these are newer drugs, but scientists and researchers have been studying these medications for a very long time. Believe it or not, these medications that are changing the game for diabetes and weight management were not just created in a lab. It started with a fish and a lizard. A fish and a lizard is where it started. And again, I go back to the decades of scientific information, not just someone's opinion. This goes back decades, and there is research that is linked and connected to a fish and a lizard. Now, that's the interesting piece that I want to get into. I believe that understanding how we got here and better understanding GLP-1 medications can help us. I know that this is why I do the deep dive and go into the research in order to have these conversations with the women that I work with who use GLP-1s as a tool. And then also for myself, because I'm a GLP-1 user, I want to learn all that I can about the medication that I am taking, which is really not a medication. It is a peptide that mimics the GLP-1 peptide that our bodies naturally make. So these are powerful tools for individuals like you and me. I know I shared that this all started with a fish. We're not going to cover the fish today. If you're interested in the fish, I can get into that in another video, or you can read this article and deep dive on your own. But today I want to get into this interesting little creature called the Gila monster, because that's where the breakthrough really happened in terms of finding out about a GLP-1 and how it is connected to the appetite. This Gila monster, which is a lizard, is found in the Americas, but more closely towards Mexico, is so interesting because a researcher by the name of John Ng discovered this peptide in the venom of this desert lizard. This peptide was called exendin-4. So exendin-4. It was structurally similar to a GLP-1, but it was much more stable in the body. This Gila monster is able to consume up to half of its body weight in food. It can consume half of its body weight in food, not gain weight, is able to use it as energy and maintain its functioning. While the GLP-1 breaks down in less than a minute, we know how that works, the exendin-4 could last up to 2 hours. And so this researcher found this information out by studying this venom of this Gila monster. And this information was then published into a journal, the Journal of Biological Chemistry, in 1991. So remember, going back, the beginning of the research and studying of GLP-1 started in the 1970s, 1979. And between that time and I want to say 1983, they were really diving deep into it. So this information is not new. They are just getting to know more about GLP-1s and how they work in terms of medication for human beings. With this, the first GLP-1 drug was developed in 2005. So that's where the whole 20-year research in terms of GLP-1s came into play, because I always talk about that 20-year decades that we have information on GLP-1s, but that's where it started because that's where the first drug was made. But the research was being done way before then. So that's important to know too, because when we hear people who, there's so much, people have so many things to say about GLP-1s, but when you go and you do the research and you get the evidence on your own, you have more information versus someone else's opinion. So then also this John Ing's discovery, at first it didn't get much traction. Like, people weren't believing it, but there was potential. And so he decided, hey, there's potential in this peptide and I want to secure a patent. And he partnered with this pharmaceutical company, Amy Lin, and they created this peptide called exenatide. So the first GLP-1 based diabetes drug, exenatide, was created. And so here we are today because of this. And in 2005, that's when the FDA got involved and they went ahead and they approved this exenatide, this GLP-1 medication for diabetes treatment. So how exciting is that? That is so exciting. I'm such a freaking geek, but I love it because it's not about what you hear. People have their opinions and they have things to say and they don't do the research and they don't know. This is me covering really basic information, but I do the research. I read these articles. I'm figuring out the trials and understanding the numbers and seeing what benefits came from these earlier GLP-1s versus the GLP-1s right now and what that looks like. These medications are evolving and they are doing amazing things for human beings. This is why we need researchers and scientists. So I just wanted to geek out with you all. I thought this was so fascinating and it's fun information. If you're kind of icked by lizards and fish and things, this might not be for you. I hope that you read more on GLP-1s. Do your due diligence so that you are aware. And I hope that you're doing well. All right, I'll see you in the next video. Bye now.